lower lateral long. And these letters refer to trigger points and leg checks to make sure that when you use SOT blocks on the pelvis for the correction of sacroiliac joint dysfunction, you're doing it properly when you have a Category 2 patient. To palpate the upper inguinal ligament, the U, find the ASIS, place your thumbs just medial and inferior to the ASISs, push in and rub across and ask the patient, is either side worse? Okay? And then the lower is the insertion of the rectus abdominis at the top of the pubic bone. Push in and rub across, ask the patient, is either side worse? Then find the top of the kneecap, come halfway to the medial leg, not all the way medial, not to the adductors, but to the sartorius tendon, rub across it. You're at the level of the top of the kneecap. Rub across, either side worse. And then the lateral leg is actually the IT band. Rub across it, either side worse. In order to use Category 2 blocking safely and effectively, the high block will go on the UMS side. In other words, upper inguinal ligament, medial knee pain, short leg, all on the same side. That gets the upper block. Then you automatically place the lower block, and I'm going to show in a second how you do that. You might not have UMS. You might have LLL, in which case you have lower inguinal ligament, lateral leg, worse on the long leg side. That gets the low block facing up. The other side gets the high block. So I'm going to block Dr. Oppenheim according to what he usually has, which would be short leg on the left. Bend this knee and lift this hip. Straighten that leg. Bend this knee and lift that hip. Straighten that leg. He would have had a weak arm fossa. So at that point, I would redo the arm fossa, hold, and hold. And I'm going to reach across just for the purpose of illustration here, and hold. And when he's strong, I would take the blocks out. The average blocking time is probably about 30 seconds. But remember this, the maximum is 2 minutes. Don't leave a patient on the Category 2 blocks longer than 2 minutes.